Hello everyone. So many patients are having heart attack in our society, and after that they will get treatment either in the form of coronary angioplasty, that is what is known as stenting, and the heart operation, that is known as coronary artery bypass surgery. After the operations and the intervention procedures, and even a patient who has suffered a heart attack in his life should have certain protocols in the life. So she should be a disciplined. This is the second life after a heart attack or an intervention or a procedure on him. So he should adopt the certain lifestyle, what is known as lifestyle modification and exercises, which are very important for all the patients who have undergone heart attack or they have undergone any procedure. So certain steps are there how to discipline your life, how to maintain your life. So we will be telling these things in coming 1 or 2 minutes. So apart from regular lifestyle modification exercises and various activities which are being prescribed, one should take regular heart medicines and the medicines which are prescribed for hypertension, diabetes, obesity, hypothyroidism and other associated diseases. This is very important to take the proper medicines. There is no replacement for any other sort of therapy apart from medicines which are being prescribed after evidence-based practice done throughout the world. So the best exercise for the people who have undergone a coronary artery bypass surgery or a coronary intervention or people who are labeled as a heart patients, the best exercise for them is walking. So they should make a habit of waking up early in the morning and just keep on simply walking. So walking has lot of beneficial effects in the patient who have undergone coronary artery bypass operations or coronary interventions or are having heart ailments. And the other beneficial effect of this is the medicines which are being used for these ailments will act better when the patient is having a habit of walking. So at least half hour of walking in the morning and half hour of the walking in the evening is recommended. But this is according to the tolerance which you are having. So immediately after the heart attack, go very slowly and try to build up when you come back to the normal life. This is according to your effort intolerance and the comfort level. And a proper advice from a physician or a cardiologist should be taken before going for the heavy exercises. So a moderate exercise in the form of simple when walking is very beneficial for the heart patients. So we are going to do a open heart surgery today, and again to conclude the whole talk, I want to say that there is a very diffuse and very bad type of coronary artery disease and very bad heart which we are seeing on these days, even for the young population. So the message of whole talk is that the lifestyle modification and all the good habits are required to have a good and healthy life. Thank you very much. So any sort of coronary or heart intervention in the form of whether it is intervention procedure in the cath lab or a open heart surgery is not a cure of the heart. It is just a treatment of the heart as a palliative care. But until and unless the good habits and good lifestyle modification things are being revived and practiced, the longevity of a heart disease survival for the patient for a long-term disease is all dependent upon how religiously he is doing the proper, nice, good activities to keep himself alive. A balanced diet is very important for the heart patients, particularly the patient who are suffering from the heart disease and the patient who has gone either coronary bypass surgery or intervention. A balanced diet which is very high fiber content and low carbohydrate diet. Avoid taking butter, ghee and oily products, and apart from that red meat should be restricted, and try to avoid the junk food like KFC and McDonald's. Take a balanced diet, that is very mandatory to keep not only the parameters in position but to keep the weight in control, because weight obesity is one of the cause which causes deterioration of the heart and heart diseases. exercise, as far as one can tolerate in moderation to start with, according to your capability, your affordability of your day-to-day activities, you can increase on the exercise level. And the best exercise for a heart patient is walking. If one can walk normally at a speed of 1 to 2 kilometers in half an hour, he can do 1 hour of walking in the morning and 1 hour in the evening. It will be very beneficial not only for heart diseases as such, but it will help the drugs to act very nicely in the patient with other problems also. So walking is very beneficial. It is the best exercise for the heart patients, and one should try to walk as much as possible. There is no dose of walking. So smoking is very bad for the heart and the heart diseases. At any cost, you should not smoke, and not even you should smoke. You should not sit with someone who is smoking. Alcohol is also not required. Only who are having a habitual of the alcohol, a moderate quantity of alcohol is what is written in the book is recommended. But according to my criteria, there should be no alcohol. So there should be no alcohol, no tobacco chewing, no smoking, and no substance abuse. This is very mandatory to keep the heart and overall body in position. All the medication should be taken regularly as prescribed by the practitioner, the doctor whom you are seeing. All the medicine, whether it is a heart medicine, blood pressure medicine, cholesterol lowering drugs, diabetes, hypertension, or thyroid drugs, should be taken regularly without missing any dose. And the regular checkup with the physician is to be done at regular intervals to keep the heart healthy. Apart from that, one should try to accumulate a relaxing exercise. It is depends upon the hobby of a man, choice of the man. You can go for a music, you can hear a FM channel, or you can go gardening, playing, or going for a travel. So whatever suits you well, you should do a yoga or something to have exercises in such a way, deep breathing exercises, so that it relaxes your mind. Have a adequate sleep. A nice sleep is required. Do not have late night shifts. Try to sleep early in the night and wake up early in the morning. All these activities are required to keep the heart healthy and going forever. Have a nice day and all the best.